Pam, what are you and everybody else here hoping to get out of today?
We're hoping to influence the way mental health services are designed in the future. And I know that's a really big aim and it sounds like it's out there and it's not going to happen. But I think because commissioners who make the decisions about mental health services have put money into this project to ask for people's opinions, I think that this time they really want to listen. And I think these are difficult times. The government's talking about budget cuts, so we've got new mental health policies coming. It's a good time for us to be saying what sorts of services we want. So I think it's a fortunate time. It's a huge aim we've got, but I think we can do it. That we can provide evidence to mental health commissioners of what service users are thinking and feeling about the services they've got. After all, the people who use services know where the gaps are. They know what's working well, what's working less well, so they can give really useful feedback on the things that should be continued and maybe the things that need to be changed to provide a better service that will better meet our needs.
You have the three busy tables here this
Yes.
afternoon. Is there any particular issues that have come up that have surprised you or caught your attention?
Lots. Well, the fact that the table that was mainly people whose first language isn't English, they were saying how difficult it is to access services because they can't get interpreters. And they were talking about that that's been going on for 8 years. Now surely in 8 years that situation could have been remedied. So that surprised me. Other things that have been really useful, people talking about having more than one problem. So they might have a mental health condition and they might have a drug or alcohol issue, or they might have a physical condition, and that they're not, one thing can be treated and the other ignored, or they're not getting a service that meets all of them. Some people being worried about this agenda that's called personalisation, where people are given money to purchase services rather than have a huge service provided for everyone, that people are given targeted help so they can buy something that suits them. And it sounds like a good idea, but because it's new, people are frightened of it. Does that mean if I get that I'm going to be dropped and there won't be that safety net of the NHS there for me, for example? So I think policymakers sometimes come up with really good ideas, but they're not good at explaining it to people.
Is it, I don't want to, every time I'm interviewing people from the health service, I want to bore them with the ones. Yesterday was the opening of the drop-in health centre in Grays High Street with the old Woolworths.
Oh, I saw that, yes, yeah.
But should I be asking every day what impact will the new government have on you?
I think people are asking that all the time, and it's a relevant question because it's in people's minds. It will have an impact, but I think in one way it's old news because we've known that we're going to be changes, and the Tories said that they want to do it quick, and Labour said no, we need to do it a bit slower, but we've all known that it was going to happen, so there will be changes. I think the pace of change is going to be fast, and that will be difficult to cope with because any changes for vulnerable people makes them anxious. So I think we need to involve people. It's even more important to involve them in a conversation with planners around how can we face this together. Because everybody agrees that the problems that we have as a nation about funding our care and funding our health are enormous. And so the best way to deal with that is to get consensus and work together on it, I think.